So the Ugandans want to know that
the place is closed. You cannot blame them. How is that?
I'm okay. How is that? I can't. Never to remove
making time for this important activity, the first of several others that we intend to host in this new normal. And probably towards the end of the month, we are going to have other presentations on COVID-19. As you may all be aware, COVID-19 has presented unprecedented impact on the health, economies, livelihoods, and the way we work, both nationally and globally. It has created a lot of demand on our nation's science, research, and technology competencies. Research is critical for providing solutions to societal changes, and Uganda National Council for Science and Technology, as the agency with the core function of initiating, developing, monitoring, implementation of strategies to ensure that research in Uganda is sound and conducted in a safe and ethical manner. The impact of COVID-19 on research is very real. COVID-19 has no doubt affected research and research practices in several ways. For example, some researchers have to adjust their methodologies to cater for the standard operating procedures, the SOPs for the prevention of infection and spread of the disease that were provided by the Ministry of Health. Some research initiatives have been suspended because their target communities and institutions are still under lockdown or have been affected by the lockdown. The overhead costs of research have gone up with the increased cost of transport and demand for laboratory materials occasioned by the pandemic. Timely supply of some research materials was also constrained by international travel restrictions, while funding of some research programs is threatened by the change in priorities of the government and development partners. At the UNCST level, researchers can no longer submit their research applications physically, and the monitoring of research in some locations is still restricted. On a positive note, however, researchers are focusing on novel research areas such as COVID-19 and similar diseases which are potentially devastating to economies. The pandemic has further provided an opportunity for significant investment of public funds in research by government, albeit short-term. It has provided a platform for raising awareness and application of our local research capacities. I wish to appreciate the patience researchers have demonstrated with the changes this has presented to the administrative management of research, and for proactively initiating research that is responsive to the demands of the new normal COVID presents. A lot of research by Uganda is ongoing on epidemiology and socio-economics of the disease. As the head of research management and quality assurance, we shall share these details with you shortly. In light of the above development, UNCST seeks to engage with the research community. At institutional level, we have taken a number of measures to address the challenges of obtaining a research permit and implementing research in Uganda. These include strengthening and full operationalization of the online research management platform, the National Research Information Management System, developing national guidelines for research involving human participants during the COVID-19 pandemic, joint review of research projects to reduce turnaround times for protocol review, and providing research grants to support science journalists and communicators on the African continent. In addition, we are also producing and disseminating factual information about the pandemic. These grants are provided within the auspices of the science granting councils. These efforts are not without challenge, especially for research involving human participants. For example, critical processes such as obtaining informed consent are complicated by online approaches. Compensation of research participants' transport costs, which have gone up because of the new guidelines by the government for public transport amidst restricted research project, among others, are still for discussion. The Council is, however, optimistic that as we work together, we shall be able to overcome these hurdles. As I conclude, I wish to acknowledge the support from partners, the regulatory authorities, that is the National Drug Authority, the Uganda National Health Research Organization, Uganda Wildlife Authority, Uganda National Health Laboratory Services, amongst others. I wish to thank the Research Ethics Committees and the Research Ethics Committee Chairs Forum that has played a significant role in guiding the conduct of research involving humans as research participants. We look forward to hearing from you during this and subsequent forums in this regard. It is envisaged that this engagement will result in more research initiatives addressing pertinent societal challenges, increasing awareness on new developments in research management, and better service delivery and transparency on the part of the UNCST. You are welcome once again to this seminar. Thank you, and I hope for the best deliberations during this forum. Thank you. So I hand over to the moderation team. Thank you.
Does everyone hear me? Okay, ladies and gentlemen, welcome to this webinar. My name is Carl Kadu and I'll be moderating this session. Thank you, Dr. Moll, for the introductory remarks and opening up this webinar. I will start with a few housekeeping tips. Please keep your microphones off or on mute. This webinar is strictly 1 hour. For your information, the webinar is being recorded for quality purposes. For comments or questions, please raise your hand or alternatively use the chat option. Okay, with those few, let's dive in. The research regulation is a component of research ecosystem in Uganda. Research regulation is essential to ensuring quality standards are observed all over the country. In Uganda, this research responsibility lies with the Uganda National Council for Science and Technology. For the last 30 years, the research management process has routinely evolved with a view of improving service delivery and easing stakeholder experience. With the arrival of the COVID-19 pandemic, while the arrival of COVID-19 pandemic disrupted main business processes, UNCST was able to migrate to the digital platform with ease. The research application and permit issuance processes was entirely moved online in observance of the standard operating procedures and minimum interruption to business flow. The purpose of this webinar, therefore, ladies and gentlemen, is twofold: to share with you the changes in the research management processes as occasioned by the COVID-19 pandemic, and also obtain valuable feedback from the members of the research community. Ladies and gentlemen, we have two panelists today, and they include Mrs. Helen Opolot, who is the Assistant Executive Secretary and Head of Research for Development and Technology, and Head of Research at the Uganda National Council for Science and Technology. Ms. Opolot will make a comprehensive presentation on the entire process of research for the last 30 years, and also give us highlights as to how the new system is working. He should be assisted. On the panel, we have another gentleman who is in charge of ICT at the Uganda National Council of Science and Technology, Mr. Collins Mwesigwa. He's the gentleman leading the digitizing processes, including the research management system. So should you have any questions regarding the technicalities of the system or challenges regarding the research registration system, you'll be the gentleman to address those questions. Ladies and gentlemen, with the interest of time, allow me invite Mrs. Opolot to take the screen. Mrs. Opolot, you're welcome.
Thank you, Carl, and thank you, the Deputy Executive Secretary, for your remarks. Good morning to you all, and thank you all for joining us in this webinar. I would like to also thank the organizers for the webinar for providing this opportunity for us to share the research management system to our stakeholders amidst the COVID-19 pandemic. With the brief remarks from the DES, I would like to say that our stakeholders have really had challenges through this time, but UNCST has really tried so hard to make out mechanisms for solutions so that research can go on during this time. So I would like to share my screen so that we can have the presentation. Sorry, we are still solving some technical problems. Okay, so I'll talk about the evolution of research management in Uganda. I'll talk about UNCST, the National Research Management System, the clearance process of research registered here at UNCST, and research management during COVID-19 pandemic. So the first documented regulation of research activities was done in 1970 with the formulation of the National Research Council. So since 1970, research protocols reviewed by the National Research Council were based on the 1964 Declaration of Helsinki that was not adopted or tailored towards the local context. So with the developing of modern medicine in the country, there was need for establishment of a framework that would improve regulation of science, and hence the establishment of Uganda National Council for Science and Technology in 1990. So UNCST is established by the Act of Parliament, that is CAP 209, and we are affiliated to the Ministry of Science, Technology and Innovation. We have a vision to be the prosperous science and technology-led development society. With the Act, we have the research management component derived from Article 4B of the UNCST Act to act as the clearinghouse for all information on research and experimental development taking place in scientific institutions, centers, and enterprises, and potential application of results, and work in close collaboration and coordination of all scientific and technology activities of persons, institutions, sectors, and organizations. So why is conducting research very important to us? Research provides solutions to society's problems and welfare through equitable sharing of benefits accruing from the research. We have noted that through this research, after completion, water sources are established in communities. So there is sanitation and hygiene that is promoted in the communities. We also note that there is care for participants even after the research projects have ended, and even some health centers are established in some communities. So we have noted the importance of research to be as such. Then there is building of local capacity, including human resource and infrastructure, especially that comes with the collaborative research. And this can be noted through the collaborative research going on in Mbale Clinical Research Institute, where laboratories have been built through that mechanism. And we also encourage our sponsors to continue with that gesture, even with other research collaborations. There is also creation of jobs. We have noted from our analysis that over 500,000 research-related jobs have been created, and there is also income generation, which is over 12 million US dollars. We are still generating the statistics, but hope in the subsequent conferences we can give you the actual income generated through research. So the UNCST Act has given us the framework to provide guidelines and policies that are guiding the research management in the country. So we have developed guidelines for research involving humans, and these guidelines provide a national system for enhancing the benefit of research while ensuring that rights, interests, values, and welfare of research participants and their communities are protected. These guidelines have been reviewed over the years since their establishment in 1997, and the current version of 2014 is under review. It will be launched anytime soon. We are also in the process of finalizing guidelines for conduct of research in animals with the main aim of protecting the humane and responsible use of animals for scientific purposes in research and education. UNCST is also finalizing the biobanking guidelines to establish a coherent framework for establishment, operation, and accreditation of biobanks. UNCST also, under the genetic and engineering component, we have the National Biotechnology and Biotechnology Policy to provide a framework for safe application of biotechnology in order to contribute to Uganda's economic growth and transformation. We work with our partners who include NDA, the REX, and this is the structure of how we operate with them. So when a research investigator has finalized the process of his or her application, he or she is required to submit the application to the research ethics committees that are established by the council to review scientific and ethical proposals for compliance with the goal of protecting the rights and welfare of research participants. We also work with other bodies like the Uganda Wildlife Authority for research that is going to be conducted in the protected areas and National Forest Authority. So we also have the National Biosafety Committee that reviews the genetically engineered organisms. So after clearance by all these bodies, a researcher is expected to forward the application to UNCST for registration. UNCST works with the Office of the President to make sure that research conducted in the country has no harm to the citizens, and the Office of the President scrutinizes the security issues. We also work with UNRO in relation to health research. For clinical trials to be conducted in the country, one is required to submit the application to National Drug Authority, where they will obtain a certificate. So this process and all partners can be accessed from our website for further clarification. So oversight, according to the partners in the illustration, for human subjects is done by the research ethics committees in the country that are established by the Accreditation Committee for Research Ethics Committees in Uganda. It's a body established by UNCST to create for us the research ethics committees. Currently, we have 25 research ethics committees, and we hope to have more because we have mechanisms now for creation of more committees. And the functions of the RECs are to maintain ethical standards by conducting initial and continuing review of research projects with the primary goal of protecting their rights and welfare. We also hope that the research ethics committees could ensure that researchers adhere to their protocols during implementation of the research. This is an illustration of where the research ethics committees are located in Uganda. We have very few scattered in the country, but most of them are concentrated in Kampala. UNCST is making an effort of mapping out and making mechanisms, popularizing the research component of the council to see that more research ethics committees are established, especially in hospitals where there is so much research conducted, and universities. So oversight for genetically modified organisms is conducted by the National Biotechnology Committee that is established by UNCST as well to approve research, development, testing, and use of genetically modified organisms in Uganda. The NBC also ensures safety of genetic engineering to humans, animals, and their health, and the environment as they are being tested. So NBC also ensures enforcement of necessary measures to avoid adverse effects to humans and animals and the environment and socioeconomic conditions arising from the genetic engineering of the products. So with all those mechanisms, we have registered a very increasing number of studies, over 10,000 of them, which have contributed to the incomes that is coming from the researchers to the country. So we have registered more research in the social sciences and humanities, followed by health. I think this is because of the large number of sponsors in those areas. We have registered few in physical sciences, information communication, and engineering. So this is the trend of research registration. We have noted an increase in the number of research studies. And with this increment, UNCST has established an online system which was first piloted in 2016 with a few research institutions. The pilot went on and it was embraced by the institutions. We had about 6 institutions that tried out the system and it was really working. So with the efforts toward extending the online system to our partners, who are the RECs, National Drug Authority, we came up with the idea of the National Research Information Management System. So we have 15 research ethics committees enrolled into the system, and they have given us 60 approvals so far. The management system provides efficient reviews of protocols by the NRS, and it also provides an interface with the NRS and RECs for the researchers. It has really favored us during data capture, data management, validation, control, and the overall regulatory compliance of research management here at UNCST and at our partners. So with all those partners that we have, how does UNCST engage with our stakeholders? We engage with our stakeholders through platforms that we have created. We have created the Forum for Research Ethics Committees, chairpersons in Uganda, which meets on a quarterly basis to discuss issues pertaining to scientific and ethical conduct of research protocols that are reviewed at the REITs. We also have the internationally recognized conference, which is the Annual National Research Ethics Conference, the ANREC, which has been conducted annually since 2009. And during that conference, we recognize those ladies and gentlemen who have had outstanding contribution in advancement of bioethics for national development. We also have a national research symposium, which we hold quarterly to disseminate research on particular thematic areas. So we have held conferences for HIV research results. We have also held those for domestic violence. We have held some for research in primates. And now we are planning to hold a conference for COVID-19 research results dissemination. So we are going to have an analysis of all the research conducted to do with COVID-19, and we shall call upon you to give us your results when you're ready. We also have interaction through short-term trainings of up to 5 days, and this is conducted in collaboration with our partners in Makerere. There is a bioethics group that we work with, and we have trained researchers, scientists, REC administrators, the chairs, and research regulators. And with that, we have noted that there is a decrease in research deviation and violation. So we hope that all institutions that require training in ethics and research and safety, clinical conduct of research could contact us for more details. So, how are we managing research during this COVID-19 pandemic? So with the declaration of this pandemic by WHO in March, UNCST held a stakeholders meeting through FRECO, and we had to devise means of conducting research during this time, because initially, as the government had declared, there was closure and lockdown and no activity was going on, but researchers found it best that they had to generate knowledge about this disease and to even come up with solutions for our citizens. So we had a task force that was formulated to develop guidelines on how to guide research during this pandemic. And these are in line with the Ministry of Health guidelines for prevention of the disease. So we require all researchers to submit a risk management plan as you register your research to see how best you can protect your researchers and even the teams that you meet in the field. So for clinical trials to be conducted, we have set up a mechanism for joint scientific and ethical review, which is done by the national regulatory authorities. We bring together UNRO, NDA, the research ethics committees, and an expert or experts in that particular field. So this joint review mechanism does not intend to replace the procedures of research registration in the national guidelines. However, we only want to optimize the review and approval timelines. So as you submit your protocol, if you're interested in the joint review, we do a screening for completeness of the protocol. We appoint the reviewers, then organize the joint review, and then from the joint review, the principal investigator is required to address the comments and then submit the clinical trial to UNCST and NDA for research registration. The turnaround time for this clinical trial application registration during this COVID time is really short, because we know researchers want to get results in real time. So we have really made this time short, up to 5 days, depending on how fast a researcher addresses the comments from the review. So what are our future undertakings with research management at UNCST? We expect all research ethics committees to enroll into the National Research Information Management System by 30th November. And we are going to be very strict with that. We hope that we shall standardize all the rec processes, including payment and the review criteria, so that we have standard outputs across the research regulatory system. In the future, we hope to establish a National Research Ethics Committee to address all the arbitrations coming from the appeals, the conflicts coming from researchers, research ethics committees, so that we can have a platform that provides solutions in real time. We also want to provide an international system for certification and accreditation of research and technology institutions. And we want to also establish a research integrity liaison office and development of the National Research Integrity and Code of Conduct. And we hope with that, we shall have a better system for managing research in Uganda with all our stakeholders across the country. We thank you very much for listening, and we hope to answer all the questions that are related to this presentation. Back to you, Carl.
Yes, thank you, Helen. Thank you very much for that presentation. We have a few minutes left for questions. I don't know if any of the attendees have questions. Please raise your hand or feel free to type the question or comment using the chat section. But before we get to that, I have a few questions for you, Helen, to maybe help clear out. From the presentation, you indicated that there are so many research ethics committees concentrated within Kampala. Why is that the case? Yet, from my understanding, most of the research is done from outside Kampala. So why is the heavy concentration within Kampala? And another maybe if you could note down these questions and answer them, address them all at once. What's the difference between the NRIMS system and the research registration system? Are they synonymous? Are the names different, or the two systems are different? Then the third one, in regard to the COVID trial, the CTAs that you are currently handling during the COVID, this pandemic, are we handling only trials for COVID research or all CTAs that are happening within this period? Thank you.
Okay, thank you very much. For the first one, why do we have concentration of more research ethics committees in Kampala? The reason is because there are so many research institutions in Kampala, and probably the mechanisms to provide the establishment are also there for those research ethics committees. But we have done always through our development partners like EDCTP to get a grant that has trained hospital directors to have a possibility of establishing committees in their hospitals. So we hope there will be more RECs established all over the country through the hospitals and other research institutions that are spread out of Kampala. So what is the difference between the research registration system and the National Research Information Management System? I don't think there is any difference. The only difference I think could be the name stated. I could say we have since transitioned to the National Research Information Management System. Since now we are online, we are not receiving hard copies anymore. So now we have the name, the National Research Information and Management System. Could you please remind me about the third one? The last question?
Oh, the last question I was asking about the CTAs that you're approving during this COVID
Yes.
period.
It's very
Are
clear.
Sorry,
It's
the question was, are you only addressing COVID research, CTAs in regard to COVID, or other CTAs as well that are happening within this period?
Okay, so we have always had joint reviews since 2016. Joint reviews are basically for clinical trials. However, what makes it different during this time of COVID are the turnaround times. So in the past, we have had a longer time of up to 15 days of clearing clinical trials. But for now, during COVID time, it is about up to 10 days. So clinical trials, both those conducted during time of COVID and those related to COVID, plus those that are not related to COVID, are reviewed jointly for those who are interested to have the joint review. But if you're not interested and your clinical trial is not related to COVID, you can go for another mechanism, the other normal mechanism, which is not the joint scientific and ethical review.
Okay, Helen, thank you very much. I have a question from Professor Tushabe from Soroti University. And his question is, if research is not directly on humans, all animals, all biotechnology directly, should it also pass through UNCST?
Okay. All research intended to be conducted in the country should be registered by UNCST. And you run a risk of being apprehended by the local government through our resident district commissioners if you don't register research. So to be on the safe side while you're out there in the field, you're required to have a permit from UNCST and Office of the President. So all research intended to be conducted in the country should be registered.
May I add something?
Yes, please.
In relation to the response, yeah. So thanks, Helen, for the response about research registration. And apart from the normal in-country regulations and procedures, but actually internationally, for your research to be recognized, it must be registered and by a competent authority. And in Uganda, it's the Uganda National Council for Science and Technology. So sometimes you may produce very good quality work, but then when you submit it for publication in some forums, especially very reputable forums, they will ask if your research has undergone ethical approval, review, and the like before it's published. So that's one thing I want to add. Thank you. Over to you, Carl.
Thank you, Doctor, for that clarification. Helen, there's another question for you from Ms. Ivana Misango. What is the average turnaround time for low-risk studies?
Turnaround
time for low-risk studies.
Low-risk studies. According to our guidelines, we have approval for 10 working days. That is according to our guidelines. And we are working towards that. We hope our stakeholders appreciate. Back to you, Carl.
Mr. Collins Mwesigwa. Collins, are you there?
Yes, I'm there.
Okay. And I'll throw another question to you in regard to NRIMS and the research system, just to clarify on how this integration works, since you are the man behind the entire system. Would you like to clarify on that? How?
Okay, thank you, Carl. I'll just talk about this in terms of the historical evolution of the systems. We started the digitization of this process with UNCST being able to put its research management systems online. And we went online in 2016. So over the time, we developed requirements to have other regulatory agencies be part of this system. So around it, we built other functionalities that support submissions for REC, integrate with UNCST, that the system that we had, and also have capabilities to be able to share information with the NDA and other regulatory agencies. So we had users who had created accounts and had gotten their permits issued through the research management system. And at the launch of NRIMS, they might not have had accounts onto NRIMS. However, we've been able to integrate the user login databases that those who log into the initial system can be able to access the interface to submit to research ethics committees and IRBs without necessarily having to create a new account. And at that point, you are able to use your same login for submissions to the RECs or submissions to UNCST if you do not need a research ethics clearance to be able to get a research permit. So to a greater extent, they have been integrated with the exception of a few users who have not been able to submit to research ethics committees as a result of the nature of the studies that they are doing that might not require that kind of approval. So eventually, we'll be able to achieve what Ms. Helen Opolot was talking about, a complete convergence of the two systems so that users are able to have a one-stop center for all regulatory processes required for research clearance. I hope that sheds a bit of the clarification that you wanted from me, Carl.
Yes, Collins, but before I let you go, there's just one other intervention that I'd like you to address. What are some of the challenges since we went online during this COVID pandemic, what are some of the challenges you have faced as the administrator of the system, or you've been getting from the researchers, and how have you addressed them? And as you address that, maybe you can also factor this in, that we have realized there are some researchers, much as the communique went out that all submissions should be made online, but there are some researchers that continue to deliver hard copies and their bounds that they get. How would you address such challenges? Do they have system challenges? And how can we intervene, help them to optimally utilize the system?
Carl, you are asking very many difficult questions in one question, but I'll
Actually,
give it a shot. I'll give it a shot. Don't worry.
it's
So,
one question in one, Collins. If I may rephrase
so
it, okay, so clearly.
no, it's
There-
okay. I get your concern. Don't worry.
Okay.
Let me try to attempt it. The since COVID came through at UNCST, there's a communique from management that would not accept hard copy submissions, and this is in tandem with the research. The guidelines for Ministry of Health and Presidential Directive, plus also the scientific knowledge that we know that paper provides fodder for this virus for a longer period of time. So I think this was, trying to protect both the UNCST employees, but also the researchers to try and stay as much as possible from paper. But having said that, going digital provides other benefits that regardless of anything else, we should all be embracing putting our business processes online. In all sectors that we work in, and particularly for our case in digitizing research management and all the processes gives you an opportunity to get statistical analysis quite easily and other information that you would otherwise take a lot of time to get if you are going to have an archive of manual submissions across board. So it's unfortunate that some of the researchers have come here and they have been bounced. There is no any other way that we could have done it, but at least our security people are very polite. They talk to them nicely and they get to understand that this is a procedural issue and it is in tandem with global guidelines on how to be able to curtail this pandemic so that we continue to do our work, but we also remain safe. Human life is the most important thing in everything that we do. So, and as far as challenges are concerned, yes, we are, I would say, at the beginning of the adoption process. And this means that people would have a challenge or two in trying to access the system, but also the system is dynamic. As these challenges come from the researchers, we document them, we discuss them here, and then agree on trying to either improve the system, add in features that they are looking for, remove some of the features that they think are redundant. And important to note is this is a living system owned by Uganda, and it is a system for the researchers. So they determine how this system will look like, how it will function, and how it will be able to be used. So we do not see this as challenges. For us, we consider it as feedback that feeds into our continuous improvement mechanisms so that we are able to facilitate them much better and more efficiently. Carl, have I satisfied your many questions in one?
Yes, you've answered everything. Thank you so much. Okay, thank you for clearing that, Collins. The system is, like he has said, the system is living. So all feedback from all researchers is welcome to enable improve the system better. Helen, I have extra questions for you here from Paola Mobilu. Should all COVID-19 research-related protocols go through the joint review system?
No, not all COVID-19 research protocols go through the joint review system. We only stated clearly, even on our website, that it's only clinical trials. Clinical trials are the ones that go through the joint review mechanism. But for research related to social behavior, probably you're looking at the effect of COVID on the production system in the country, all that has to go through the normal research clearance process through the regulatory bodies, REG, through the normal channels of clearance. But for COVID-related clinical trials, those are strictly through joint review. And more details can be obtained from the website in the COVID corner.
Okay, Helen, there are still more questions. Be prepared. Don't get tired. There's another question from Miss Farida Chambade. She's asking who selects the REC committees, what criteria, and is there room for institutions who have not yet taken advantage to be part? I think she's inquiring about the criteria for setting up a selection, for setting up a rec.
Okay, so we have an established body of 5 members, which is called the Accreditation Committee for Research Ethics Committees in Uganda. This is an independent body that was established by UNCST to create for us the research ethics committees. So there is a criteria, and we also have guidelines on the website for following up as one wants to establish a committee. So that researcher or that stakeholder should look up the guidelines on the website. And we have a set mechanism for quality assurance of research ethics committees in Uganda. We have the credit point system, which we have established, and this has to be completed or implemented by the research committee members. It's an online system which was developed locally here by our IT person, that is Collins, and I think it is reviewed routinely or on a daily basis by the quality assurance division. I don't know if Winnie is on. She can elaborate more about that system. Carl, you could probably find out if Winnie is in the system, and then we can have a response from her about that. But there is a mechanism for establishment of research ethics committees. Over to you, Carl.
Okay, Helen, thank you. Thank you for the response. As we wait for Winnie to interject or provide more clarity, yeah, there you are, Winnie. Winnie, you want to jump in? Hello? Okay. Unmute. Faizo, unmute Winnie. Okay, as we wait for IT to work on getting Winnie on, Helen, maybe you could be answering this question as from Robert. Does UNCST have a preferred template for the risk management plan that should be adhered to when developing the risk management plan? So Robert from Mbali.
No, we don't have a template for the risk management plan, but we hope you can capture all the safety measures that will be required for your teams and research participants that you find in the community. We gave small guidance in the guidelines, but we hope that you can beef it up with both the national and international guidance that we have on COVID-19. But the basic ones are in the guidelines, and we don't have a template. And we believe that it will be on a case-to-case basis, depending whether you're conducting a clinical trial or you're conducting the social behavior study. So we can't have a standard template because the research is conducted on a case-by-case basis. Yeah. Thank you.
Okay, there's another one for you. What happens to research conducted in the country without approval? And what are the benefits of registering protocols and how it is enforced? How its enforcement is done regarding violating regulations? I think he's inquiring if there are any penalties for if I don't register my research and I go ahead and conduct it. What are the penalties, if any?
Okay, I'll start with the benefits, like highlighted by the Deputy Executive Secretary. He says, for your research to be published, you need to have regulatory clearance, so that is the benefit. And if you don't have that clearance, you might fail to publish your research. There are penalties for not registering research. We have guidance in our guidelines for those who don't conduct research, when it is okay, if you conduct research without the clearance and you go out there, of course you'll be, if you're an international researcher, you'll be deported after being discovered by the RDCs out there. But for a Ugandan, of course, we don't have strong enforcement for now, since we don't have a regulation, but we are hoping to work on the regulation. So for now, it is very easy for someone to go away with without registering, but we hope in the future we shall have regulations which will have stringent penalties for not registering.
Okay, thank you. Ellen, may I add something?
Yes, doctor, please go on.
Okay, yeah, thank you, Ellen, for the response, but I just want to add, as Ellen mentioned, it's easy to go away with it, but at times it could be disastrous, especially in certain instances. It might even lead to reputational risk for the institution, but also for the country. Because actually the guidance we provide actually makes your research very authentic. I can give an example of a scenario that I watched over the TV. That was, I think, Uganda Broadcasting Television, where a lot of researchers were like using rats that have been reared by a person who has not been trained in animal handling and the like. So you may end up in a scenario that you have got very good and impressive results, but again, you have to learn that if your results are outstanding, then on top, it will have a much more stringent scrutiny even after your work is finished. And this can actually lead to retraction of your work. You can end up losing the resources that you have invested in that research, and then the reputation, not only for you as a researcher, but also the institution and the country may be affected. So while there is no stringent enforcement mechanisms in place, still there are serious consequences in one way or another in terms of the scientific validity of the research that has been conducted. Thank you. That's what I wanted to add.
Carl,
Thank
can
you,
I
doctor.
just add?
Yes. Oh, okay. Thank you,
Like
doctor.
inform stakeholders
Okay.
that UNCST does not grant retrospective approvals. So if you have not registered your research and you realize that after implementation and you realize that now you need to register your research, we don't grant retrospective approval. So please endeavor to register your research before you start conducting it. Thank you, Carl.
Okay. Thank you, Helen and doctor. I think, Chris, you had the repercussions are more stringent. Maybe perhaps he was looking at getting a prison sentence if you caught in violation of the regulations, but looks like the repercussions, the future repercussions are more stringent than he hoped for. And this one was addressed to Collins, but I think Helen, you can handle it. It's from Christine from Mbarara University. She's asking how long it takes to get feedback after online submission. It seems like it's taking long to get back the researchers. Do we have a backlog? Kind of. Helen?
We are working on clearing all the research that we receive. It should ideally take 10 working days, according to our guidelines, to have a research protocol approved by UNCST. But of course, with the introduction of the NRIMs, we are still working out around managing the challenges with the new system. So we hope we shall really improve and have all the research registered within 10 working days.
All right, and there's one from Anonymous. NBS manages research on GMOs in Uganda, but there's a lot of controversy on this subject. What has the NBC done to reassure the public on the safety and the process taken to ensure safety?
We have a biotechnology officer by names of Musa Kwehangana. I don't know if you can invite him to respond to that concerning biosafety.
Okay, as we wait for Musa to join us, could you, Helen, handle these two questions? Someone is asking, Miss Agnes Sari is asking about the role of the National Ethics Committees. I think she doesn't get the explanation what's their importance and what's their role. And you could also combine it with Mr. Joel Saleh's questions in regard to the trainings. Who qualifies for the research training and when is the next training happening? Then we can have Musa.
Trainings for stakeholders are made on request, and we always hold the trainings according to request. We hold them routinely on an everyday basis. So once you have a need for research ethics training, you can just inform us, and training is handled by the Quality Assurance Department. So we shall be ready to train you. And the role of research ethics committees is to basically conduct initial and continuing review of research protocols to protect the rights and welfare of researchers, and to also ensure that protocols are conducted according to what has been approved by monitoring. And research ethics committees are required to monitor all the research that they approve. And after that, they have to give us a report during the FRECO forum that is held quarterly. The chairpersons convened, and they give us reports on how they have monitored and what challenges they face during the review. So that platform is where all those are reported. Yeah, thank you.
Okay, Helen, before I let you go, since our time is fast spent and want to get to Musa as well, maybe you could, this could be your final questions from Philian from Mbali. He's a lecturer and is asking that I think most private universities in Uganda are not doing well in research and its procedures. Is there a plan for UNCST to strengthen universities in research?
I think this could be to strengthen research conducted or to strengthen the research registration. We are making the communication strategy where we are going to go across the country popularizing the research management system of UNCST. So with that, I think all research conducted either private universities or public will be registered.
Okay, Helen, thank you so much. Musa, are you on? Could
Yes.
you answer Anonymous's question?
Can you hear me now?
Yes, I can. Can I ask you the question again, or you took note of it?
Yes, you can rephrase it again.
Okay, he says, GMOs are a controversial subject in Uganda. What has NBC done to reassure the public on the safety and the process taken to ensure safety? It's basically around the GMO safety.
Thank you, Carl, for that question of Anonymous. The National Biosafety Committee has put in place procedures for a risk analysis framework, which undertakes risk assessment of all GMOs in the country before they pass the test of further use. So there is a process which is involving risk assessment, analyzing all the risk scenarios, and coming up with a risk analysis report, which informs the decision on how to move forward. And this is also done in accordance to the Cartagena Protocol on biosafety, of which Uganda is a signatory. So the framework is there, and we also have a communication strategy where we normally inform the public and communicate with them and also get their feedback in regards to biotechnology. So I want to assure Mr. Anonymous that the UNCST, as the competent authority for biosafety, evaluates and looks at all those elements regarding risks and pronounces itself. And also maybe to add that internationally, there has not been any controversy relating to the safety of GMOs, apparently according to our records with the report that was published by the National Academy of Sciences. But in short, the evaluation is done, and I want to assure Mr. Anonymous that all that is taken care of. Thank you.
Thank you, Musa, for that clarity. There are lots of questions still flooding in, and unfortunately, our time is fast spent. Helen, let's handle this last one. It sounds pertinent to me, and it's from, I can't get his name for now. I would like to inquire the fees charged by UNCST. Some young researchers can only attract micro grants, say 1,000 Canadian dollars, yet other projects may have major funding. Is there a provision to fairly charge such micro grants, or even waive the fee completely? Ivan.
Okay. We don't waive fees at UNCST, but the fees that we charge for academic research is $50, and for non-academic, we charge $300, which is payable in the bank. We don't receive cash here at UNCST. All payments are made through the bank. Thank you.
Okay, thank you, Helen. I still have like 3 questions on the REX, regarding the REX. I don't know if Winfred could jump in here. Looks like the REX question didn't come, wasn't answered well. Okay. Wait a minute, doctor. Doctor, I want to intervene.
Yeah, seeing that the discussions is going on, could we just like extend for like around 10 minutes up to 11:50?
Okay, sir.
Okay, thank you.
That's 8 minutes extra. Thank you. Thank you, doctor, for the intervention. Okay, Winfred, I have 2 questions here for you. One in regard to the REX. One is asking again, what's the process of establishing a REC? Maybe you could note down this other one. How can RECs whose licenses have been revoked apply for reconsideration? And the final one, can we get clarification from Helen? I think you can answer this, about the requirements or processes for institutions to establish research ethics committees.
That is the same with the REX.
It's the same as the first one. They're all around asking the same question. Winfred, you can take it on.
Okay, can I come in? Carl, can you hear me?
Yes, we can. Yes, we can.
Okay, thank you so much. Hope you can hear me clearly. Okay, so regarding establishment, and I'll take these 2 questions at once, process of establishment and requirement for establishing a research ethics guidelines. We have a section in the national guidelines for research involving humans as research participants that gives a detail on establishment of a research ethics committee. So any institution that is conducting research has an opportunity of establishing a research ethics committee. So when you go to the guidelines, there is a clear description of the composition, establishment, requirements, obligations. So I would refer our stakeholders to the national guidelines for research involving humans as research participants. And that copy is available on the UNCST website. Then we also have guidelines on accreditation. So any institution that wishes to be accredited, you'll make an application to the UNCST. And like Helen stated earlier on, these applications are reviewed by the accreditation committee. We have an accreditation committee at UNCST that reviews the application. So once you've made an application, this is looked at by the accreditation committee. There was an earlier question about criteria still for composition. This is still covered in the national guidelines. So I refer the stakeholders to the national guidelines. It gives a clear description of who best suits to be a member of a research ethics committee. Then regarding accreditation of any REC that has been terminated, please feel free to apply for to make an appeal still at UNCST. If the REC was terminated, you can appeal, and this will still be reviewed by the accreditation committee. If there is justification for this REC to still function, the revocation can be lifted. Thank you so much. Hope I've handled the issues as required. Oh, then there was an issue about the credit point system, but Helen elaborated on this. This is one of the mechanisms that UNCST has put in place to review performance of individual REC members. So this is for the individual REC members, not an entire committee, but individual REC members. We want to see other REC members attending the meetings as required. Are they attending research ethics trainings? Are they conducting site monitoring visits? So this mechanism is meant to review performance of individual REC members. And this is done at an annual basis. So at the end of every year, the accreditation committee reviews performance of each individual REC members. And if we see members that are not performing as required, the accreditation committee may recommend the institution to replace such members with other members that are willing to perform and duly give good service to the research ethics committee. I submit. Thank you.
Thank you, Winnie, for that elaborate explanation in regard to the RECs. Collins, there is one question for you here. If you could jump in. Someone is concerned about the safety of the data submitted online. Reassure them.
That it is safe.
This question, what is the safety of the data we submitted online?
Okay, thank you, Carl. The data that you submit to UNCST for purposes of getting an approval to conduct research in Uganda is safe, and it is used only and only for that purpose. For the last 5 years that we have tried to implement these digital systems, we have not had any incident that gives us an indication that we probably have not provided for sufficient controls in trying to make sure that the data is protected. So just broadly speaking, maybe we'll talk with him privately if he wants to know the exact tools that we are using too. But broadly speaking, we have maintained an acceptable level of information security for the data that you give us, and we continue to pledge that that is what we aim for, to make sure that you have confidence and trust in the systems. It is also in our interest to make sure that our integrity is not compromised as we try to make access to services much easier and more convenient. Is that sufficient, Carl?
Okay, Collins, maybe I can add a bit.
Yes, please go on, Doctor.
Yeah, so I think that question is related to scenarios where you find out that some researchers still prefer to submit their applications physically. I think this is with the perception that, my concepts are original and actually I want it very secured, and maybe through the ethical review process, the submission process, and the like, I don't want anything to leak out. But as Collins have put forward, this is an in-house built IT system, and we have very strong security and controls around the data, and then even the people who review normally maintain very stringent security, even when the documents are within our office. So as it has been mentioned, over the 5 years, we have not had any security breach. So I think that assurance on how secure the information is, I think it's quite vital for researchers, and probably in our communication strategy, we can also highlight that, if you submit your documents online, it's quite secure. Thank you.
Okay, thank you, Doctor, for that submission. We only have 1 minute left. Winnie, this is yours in regard to the regs. If you could handle these last questions and we wind down. If you are still on, it's from Constance Namirembe. Your system
Yes,
requires
please,
a
I
meeting.
am.
Okay, the question is, your system requires a meeting attendance logo. How can REC members submit meeting attendance for credit units now that meetings are mostly online? I think the question is about the credit point system that you mentioned about earlier. If the members are not
So for
meeting
any-
physically, how do they submit? Please go on.
There should be evidence of a given meeting, even when it's online. There is an attendance list that is generated. So for the credit point system, we'll need evidence that a given member attended a given meeting. So you can have attendance list in addition to the minutes that are generated from a given meeting. So what we need is proof that this particular member attended a meeting. Even for the virtual meetings, the attendance lists that are generated for the meeting. And I can request Colin to, if Colin, you can make an addition to this, but that's what I would say. Thank you.
Winnie, you've done a good job.
Okay, ladies and gentlemen, thank you so much for sparing time to attend this webinar. Our time is fast spent. Unfortunately, we have to call it a close, but we promise to have more of these engagements with our stakeholders on different topics. Please endeavor to register whenever we call upon on you. This has been quite a good attendance. We appreciate the time and effort and the data you've invested in attending this webinar. My name is Carl Kadu. Thanks to the panelist I had, Dr. Martin Ongol, who's the Deputy Executive Secretary at the International Council of Science and Technology, Mrs. Helen Opolot, and Mr. Collins Mwesigwa. Thank you all. Have a good day.
Thank you.
Yes, please.